This is a video of an arthroscopic lateral meniscus transplant using the Dovetail Technique. Here I am looking in the lateral compartment, and you can see there are some grade 1 and 2 changes. There's no meniscus. I am now taking a burr to burr out the cartilage of the dovetail slot. Here I am measuring the depth and then using a biter to remove bone. I'm trying to create a trough where the bone block of the lateral meniscus allograft transplant will be placed. Here I am tamping the trough to create a nice slot for a contoured graft. Once this trough is created, then I can use a suture through the posterolateral corner that I'm retrieving now and shuttle the transplant into the joint. Here I am shuttling it into the joint, and you can see the meniscal tissue going in, and now I am putting the bone slot in. Here I'm using a trocar to reduce the new meniscus transplant into place, and I have tamped the bone in, and you can see a perfectly sized transplant with a well-matched bony trough. I then do an inside-out repair to anchor the meniscus transplant into the capsule. These are a series of vertical meniscocapsular sutures, and that is the most stable construct. Here I am going along the posterior rim and passing sutures that are then caught through a posterolateral incision between the lateral gastroc and the joint capsule. Once I have fired in sutures circumferentially from the posterior all the way to the body, to the anterior horn, I then tie these down to the capsule very snugly. Here I am probing the meniscus transplant. You can see a very well-sized, well-matched transplant that is covering and protecting the cartilage surfaces.